Welcome to the second talk on internal disc disruption, also known as discogenic pain syndrome. We continue our talk on common cause of back pain, known by some, but unknown by most. Internal disc disruption is diagnosed by a procedure called provocative discography, or discogram. Typically, a MRI is done first. The specialist will then decide if the MRI shows corresponding evidence to the patient's loss of function or pain, and maybe not. The MRI may help the specialist identify a troublesome disc. A dark disc may be seen indicating an injured, dehydrating, or degenerating disc. More information could be from the presence of a high-intensity zone, HIZ, also seen on the MRI. This may indicate a tear on the outer edges of the disc. If all other avenues of diagnosis and treatment have failed, a discogram might be done as a last resort. Before you allow or contemplate having provocative discography, research, read, and understand the pain, risk, and cost involved in the procedure. Basically, a specialist inserts a needle into the suspected disc and injects a contrast medium into the disc. As the pressure of the injected dye increases, the patient may feel pain. This is the first indication of a possible tear. The part that really bothers me is when a healthy disc is injected into for comparison. This may speed up the degeneration process of this previously healthy disc. The last part of the procedure is to do a CT scan, to look inside the disc. If there is a tear, it will be graded according to the modified Dallas discogram. Here is my artist's illustration of the modified Dallas discogram, showing more color and anatomical detail. The view from the top or cross-section of the discogram illustrates the advancement of the fissure tear. Grade 0, everything is normal. Grade 1, the fissure or tear starts forming. Grade 2 to 3, the fissure reaches the sinovertebral nerve and pain is initiated. Grade 4 shows severe irritation of the sinovertebral nerve. Grade 5, the fissure or tear breaks through the remaining holding fibers and the disc material now presses on the spinal nerve, causing true sciatica. This is now a disc herniation that can also be seen on an MRI. The procedure that will happen after a herniated disc, I am just too happy to leave to neurosurgeons. Thank you for listening to my second talk.